At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Seeing Beyond the Surface with Thermography on Wednesday, September 17th at 6 p.m. Space is limited, so register today. Call 703-698-7117.
Dr. Tom Roselle live right now on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live right here on WMAL 105.9 FM in the greater Washington metropolitan area. Those of you listening elsewhere, welcome. You know, this has actually turned into a really calm city. Glad to have it done. I don't know what your opinion is, but it's, first time I've been downtown and went down to Georgetown at night and walked around and actually walked down the street a little bit and said, hey, this is cool. And I'll let you make your own conclusions and so forth, but I find it very interesting. Anyway, let's get into the topic. We're talking about inflammatory triggers of pain and whether it's pain that triggers inflammation or vice versa. How does it happen? All you know is you're hurting. Coming up on the 17th of September at the Roselle Center in Fairfax, we're going to be doing a night on thermographic imaging, seeing below the surface, if you will. And it's one of the most important diagnostic tools for many different things. And what I'm talking about is how we miss things in the world of diagnosis because we don't see the underlying trigger, the inflammatory reactions that might be there, the blood supply that is abnormal. Dareth Painter is going to be my guest and presenter. Actually, she's the principal of Thermography Centers of Fairfax and Thermography Centers of Virginia. And she's going to be talking about breast inflammatory reactions that may be an underlying cancer or something that is not wanted there, and why we recommend it, at least as a parallel to mammography, but thermography should be done first. And we know that with thermographic imaging, you look in Europe, that's their primary go-to. It's not mammography in Europe. And they have recognized that there's a 10% false positive, false negative in thermographic imaging, as compared to almost a 30% false positive, false negative in mammography. So when you know that's the case, wouldn't you like to know a little bit more about this? Join us on the 17th. All you have to do is call the office 703-698-7117 and say, I'd like to come and register. And the only thing that we ever ask you for is if you find that you can't be there, like the day before, call us so we can make space for somebody else. Let's get into the program. Let's talk about these inflammatory triggers. So inflammation can cause pain, no doubt about it, but pain can trigger inflammatory reactions. So let's kind of distinguish that a little bit. As we get into the live stream after this on Ageless Health live stream, we're going to break it down even more. But I want you to understand what happens and when you have a pain. So can the underlying pain that you have been initially triggered by inflammation? The short answer is absolutely, positively yes. So inflammation occurs and triggers pain actually through a very complex chemical triggering pattern, but we want to make it simple, right? We want to keep it keep it simple. And we're going to make sure that you understand how this mechanism works, because it's really important, because if you want to put the fire out. So what causes inflammation? Well, autoimmune conditions, eating the stupid foods that we eat as Americans, not working out, postural patterns that we shouldn't be in, that paid for belly that we have, that tells you that something's not working the way it's supposed to. It shouldn't be there. But in good old US of A, we do all kinds of things that will cause those things, from a sedentary lifestyle, from putting stuff in that are potentially inflammatory to begin with, putting up with pain that we shouldn't have, because what happens is television says, take this and dumb it down. But even with the biologicals, and those are all of the basically the drugs that they're advertising on television, what they're doing is they're dropping down your normal anti-inflammatory triggering mechanisms. They're suppressing the whole process. And hopefully by the time we're done with the program today, you'll get a little better idea. But when inflammation uh, occurs, the body is going to trigger some chemistry. So kind of interesting, right? Inflammation now causes chemical imbalances. Okay, so we're going to talk about that chronic inflammatory nervous system reaction in just a second. But the chemistry, just so you heard it, I know you're not going to remember it, but we're going to talk about things like prostaglandins, bradykinins, substance P. You're going, oh my God, this crazy man is getting into stuff that doesn't make any sense. Well, let's talk about signs of acute inflammation. Now, just because it's acute, that just means it happens now, right? It's an ongoing process that doesn't seem to dumb down. It varies ongoing depending on the cause, the underlying trigger of these silliness. I use those words, but we're not going to get into it. So what shows up? Sometimes you get a little redness, and the redness of the body may look like blood vessels, or it can be like it's swollen and so forth. And by the way, thermographic imaging will show up that increased blood supply and where it's coming from. And that's one of the reasons we use it. Now, if there's pain that's associated with it, it's usually something that you just got hurt, you got triggered, something took place, my joint's swollen. What's the deal here? And as a result, you might feel, that tenderness by touching the area, and you didn't know it was there until you bumped it. You didn't know it was there until any kind of abnormal, acute, got your attention pain is not normal. And you have to not ignore it. You don't go in the cabinet and take, 4 aspirin and see if it goes away. It numbs it down. It drops the inflammation. Those are called NSAIDs, non-steroidal anti-inflammatory drugs, NSAID. And some people say NSAID, but it's NSAID and NSAID, either one. I'm from Western New York, so I mispronounce everything. But anyway, these NSAIDs, these NSAIDs will drops the inflammation, so it makes it feel better. Now, there's on occasion, it will break the cycle if it's something that's feeding on itself. But it's not that way the greatest majority of the time. You have to keep taking these medications, the Advils, the aspirins, the Tylenols, and so forth. They're all the same category. So as a result, you're hooked on it, but they have damaging effects. These NSAIDs will also do something else. They will perpetuate the degeneration of joints. By what? By competing for a receptor in the cartilage of the joint that is supposed to attract something called a sulfate ion that heals and perpetuates and continues to repair that cartilage. But now you blocked it because you read into your doc and, he said, take this, she said, take this. And, it's a vicious cycle. But let's talk a little bit more about this stuff. How about swelling? You can have subtle swelling. And swelling is common, when there's any kind of an inflammatory action. Why? Because inflammation, visualize it stretches. So swelling is there. It's edema. It brings other buffering systems in. It's a fluid-filled tissue. It hurts. It hurts like crazy. And it initiates pain receptors, if you will. And they're often called pancinian receptors or pancinian corpuscles, pain receptors, or mechanoreceptors if they're in the skin surfaces. And big words, right? Look them up. You're going to have fun reading through this stuff. At least I do. I know I'm weird, but that's the way it is. So, when you have this stuff, then there could be heat. There can be a warmth, like a fever, right? But it can be localized, it could be over the joint. And if you have heat or swelling and redness in a joint space that doesn't go away, now your doctor is going to start thinking about a rheumatoid pattern. That rheumatoid pattern is an autoimmune something that's taking place, usually trigger pointed to the gut. Now, here's the deal. When the patient comes in and we know that they're hurting, they're walking almost, they need a walker, they need canes, they are modifying their activity. And we see these joint spaces and we compare one to the other, and one looks swollen and looks a little stretched out and looks a little, red and so forth. So where does that get my head? That says that's coming from someplace. Where's it coming from? And we have to find out why. Now, it could be a host of different areas. You can have an irritation in the nerves that come from your spine that goes to that joint, neck to the arms, the shoulders, the fingers, and so forth, the low back to the hips, the knees, the feet, the toes, and so forth. And you've got to be able to find it. But one of the things, besides normal neurological testing and muscle function testing and tissue sensation testing, and we do a lot of different things, we also will use thermographic imaging. Why? Why would we do that? Because it's going to show me where the other triggering mechanisms might be. So let's walk through that. So if I look at your wrists and your wrists are sore, and I said, where's that coming from? Did you have an injury? Do you have a carpal tunnel? Do you have some other kind of trauma? And you said, no, I haven't done anything. It just shows up. So we're going to do some other testing, but I probably will take a thermographic image of the neck. I'll take a thermographic imaging of the gastrointestinal tract, just on the outside surface. Why would I do that, you might ask? Well, let me tell you why. Because if it's coming from the neck, I'm going to see the neck lit up in heat. There's going to be irritation if it's chronic, because trust me, if your hands are a problem and it's coming from your neck is going to show signs of increased vascular patterns, and it's going to show up as a hot area on a thermographic picture. If it's not there, I'm going to go look at where? I'm going to go look at the intestinal tract. And I'll see this all kinds of inflammation, redness over the abdominal area and colon, intestinal tract, and so forth. So we begin to tie the pieces of the puzzle together. That gives us more of an indication. So if it's the gut, what am I going to do next? Well, I'm also going to check the spine, because ultimately from the front portion of the spine is called the ventral cord, the ventral front portion of the spinal cord. There's this reflex that goes from muscles to organs, organs to muscles, and so forth. And we're going to see if that's involved. But we're probably going to do some testing. We're going to run specific blood tests, but we may do a stool test, because I want to know what's lighting up that gut. Is it abnormal bacteria? Could it be potentially a fungus, a mold? Could it be parasitic? And subtle things that normally aren't checked for. But we'll check for those things, because now that thermal imaging associated with this joint space swelling is going to tell me something differently. So I want to find out more directly what it could be. And this will give me that lead. This will give me there's where it's coming from. Now, we talked about heat, right? We talked about that swollen joint may also have a heat signal to it. Now, when there's inflammation, it's going to feel hot. You're going to feel warmth. If there's, ladies, if you have breast tissue that is inflamed, you feel one side very lightly, very gently, put your fingers on the area, and then compare it to the other side. If there is warmth to that tissue opposed to the opposite side, now don't go, digging deep, because you're not going to feel it. At that point, you're going to cause pain. But just gently feel the skin surface as is compared to the opposite side at the same area. Guys, same thing for you if you got something going on that, in any part of your body. And if there's a differentiation, that's another signal that there may be an inflamed area. It's a whole body inflammation that may be subtly showing up in specific areas, but then you go into fevers. And yeah, your fever will will get a little higher. Your temperature will get a little higher. You'll go from, I'm generally 98.6. That's just an average. It could be for you 98.2. It could be, 97.8. It could be 99. And that's normal for you. But now we're seeing it just above that chronically. That's an indication that we have an inflammatory response someplace, and the body's trying to fight something. It could be fighting off an infection, and particularly if it's gut related, it could be parasitic. We're seeing so many inflammatory responses today because of what we went through in COVID. Because we're now learning that those COVID vaccines had a lot to do with parasitic and venomous responses, which are not good for your body. But we're finding other ways of identifying it as well. How about loss of function? So if we get hurt, we get pain right away, boom. The body goes into withdrawal. You're going to kind of pull away, you tighten up the joint spaces, but sometimes they don't open up. And that system, that joint, those receptors now become what? Inflamed. It's called swelling, and it increases the loss of function as a result of those things we've just talked about. But the key is to try to find out where it's coming from. Why is it there to begin with? Why are we having to deal with it? We talked about all kinds of things right now, but there's a lot of reasons inflammatory reactions occur. Chronic fatigue. If you are overdoing it constantly, you're pushing, your fight-flight system, your adrenal system can't work the way it's supposed to. And guess what happens? You may feel fatigued and run down. You have, these, physical and mental tests are not doing well because you pushed it way too far. How about just achiness all over? Just general hurt, just aching. That could be very simply a magnesium deficiency, which the majority of you are, and you just don't know it. And you have cramping that occurs, that stiffness, that joint pain. Those are all inflammatory signals, but they could be due to something that's very simple. The cartilages then get attacked. Remember, I've told you several times that viruses, particularly Epstein-Barr virus, likes to live in joint spaces. And you can take a picture of the joint and it's hot. Now you got to find out why it's there. It could be spinal. And at some point, it's going to affect the spine because we know that that organ-muscle communication continues. But what was the trigger? It could be that. It could be an Epstein-Barr pattern. You could be all plugged up. We've talked about constipation over the last, several months. And so when you're all plugged up, that gut movement, that motility causes inflammatory responses. Yeah, you got a lot of poison in there. You got things like skatol, imbutol. Those are poisons, chemistries from inflammatory reactions due to constipation. And by the way, they're carcinogenic. They can cause problems that you don't even want to think about. So when you're showing these abnormal physiological reactions, wouldn't it be great to find out why they're there? Well, we're going to talk about it on the 17th. So join us. Please join us. Call the office at 703-698-7117. My job is to give you data. My job is to give you as much information as I possibly can and to tweak you into doing the things that you should be doing. Sometimes it's really simple. Sometimes you're inflamed because you're not flushing the garbage out. Why are you not flushing the garbage out? Because many of you think that water's for washing and not drinking, and you don't put much in your body. If that's the case, a simple act of water, clean water from filters with a little bit of Celtic or Baja or pink salt may be enough to really make you feel a whole lot different. Get that constipation to move. Some of you pass stools that are like what? They're like cement. And you go, the other day I had a patient come in and I know it happens, but you see it, way too often. This woman didn't have a bowel movement for over 3 weeks. And I said, oh my God, what happened? Why didn't you get, she said, well, that's normal for me. I said, normal? I said, where do you put it? Do you not eat? And she says, no, I eat. I just, don't have a bowel movement. And there's a lot of tenderness, a lot of swelling, a lot of inflammation around that area. The same thing can happen, we've talked about with diarrhea, but how about weight changes? Did you know that inflammation can affect your metabolic process? But here's the deal. Weight changes come about because of pain patterns. And the first impact, the first injury, the first blow, the first trauma can cause inflammatory reaction, which then can cause a weight change problem. And there's multiple pieces of that. It could be your head, your pituitary, not signaling the way it's supposed to. It can be your thyroid now getting beat up and it's at low subtle areas, but your doctor says, well, let's watch it. You're really within normal limits, but you don't feel good. It can be an inflammatory reaction because of that. How about your moods? You're constantly reactive. That reactivity can be associated very, very closely, very intimately with increased immune responses. And it says that there's an inflammatory something. And then you end up with what? Depression, fatigue, anxiety. Yep. Inflammatory reaction that may be due to an original pain trigger or a pain trigger that causes an inflammatory onset. So you got to dig it out. So we're looking at the why behind things. There's a condition that fortunately we don't see a lot of, but unfortunately we're seeing more of. It's called ankylosing spondylitis. And what happens when you look at ankylosing, what that means is fusion. And when we're talking about a spondylitis, we're talking about the spine. And we're talking about spinal segments that begin to fuse together. And the pain can be quite significant, particularly in the initial onset. But ultimately, what happens is that the joint spaces, including sacroiliac, which should be able to move, begin to fuse. And now there's no motion. And often that comes from underlying gut problems, bacteria that shouldn't be there. And if you can identify the inflammatory reaction initially, and then take the steps to find out why it's there, now you can fix it, or at least prevent it from getting ongoing. But don't ignore it. Don't just take a painkiller. Just don't take an anti-inflammatory. Years ago, there was a couple of doctors in the functional medicine community, this goes back 30 years ago, and said that there are underlying bacteria that, if they're not controlled properly, will cause these ankylosing problems in the spine. And everybody poo-pooed it and so forth. And they started treating it with very high levels of antibiotics. And what they showed was that there's things of handling that. There's ways of handling that. So join us on the 17th, and I promise you, I'm going to give you an insight to things that you really hadn't thought about. I want to take you through the chronic inflammatory pathway and show you that pain often triggers it, but also that chronic inflammation due to any other irritant, things that we've talked about today, will cause that pain pattern to be persistent and not go away. So it's not really on your lap. You can do nothing and continue to be the way you are, or you can take what I'm saying to you and get those autoimmune conditions like Sjogren's, like lupus, like rheumatoid arthritis, and so forth, and the list goes on, and handle it properly. And you can. After well over 4 decades of practice, there's very little that can't be turned around if you can identify it. And we're going to show you one process that can identify so many other things if it's used properly. Coming up to the end of the program, we're going to go to the live stream. I want you to join me. Make sure you're following me on all your social media platforms, on Instagram. I'm there all the time, Facebook, on Twitter, you name it, we're there. And check it out. If there's anything that I can do for you, if there's anything that you'd like to hear more about, send us a note, drtomroselle.com or rosellecare.com. And we'll try to service you as best we possibly can and get you the information that you need to. And if you'd like to talk to one of our docs, reach out. I love you all. Every time I tell you that, it's coming from my heart. Okay, let's go to the live stream. We'll see you in a couple.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.